Hello, welcome everyone. Just going to give it a minute for everybody to get logged in. All right, well, we'll go ahead and get started. Welcome to the 2024 Explorer program for CDC NEARS. Allow me to introduce myself. My name is Nicole Dutra. I'm a senior project coordinator here at NEHA, and NEARS support is one of our collaborative agreement programs in which we have the opportunity to work closely with CDC to build capacity for the environmental public health workforce through improving identification of best practices and the implementation of evidence-based and informed programs and services. Let me share a few housekeeping items for the webinar today. The webinar is being recorded, and the recording will be made available to all of you. We will have a Q&A session towards the end of the webinar, but feel free to drop any questions that arise during the presentation into the Q&A box located at the bottom of your screen, and we will address them at that time. So we are so excited that all of you are participating in the program this year. I'd like to take a moment to thank each of this year's participants: Idaho Department of Health and Welfare, West Virginia Department of Health and Human Services, Wyoming Department of Agriculture, Los Angeles County Environmental Health, Burlington County Health Department, Portage County Health District, Pickaway County Public Health, and the City of West Allis. Thank you all for being here. With that, let's begin. I'll quickly go over today's agenda. The CDC NEARS team is here today with us today, and they will begin today's webinar with why state, territorial, local, and tribal jurisdictional food safety programs should participate in CDC NEARS. Then we will review the Explorer program components, including program activities, deliverables, and the scope of work. CDC will go over the NEARS resources and tools that are available to all of you to assist you in gaining a good understanding of CDC NEARS and environmental assessments. We will share who you could reach out to for program support, and we will have time for you to ask questions that you might have. And lastly, I'll provide some closing announcements. So please allow me to introduce Dr. Laura Brown. Dr. Brown works at the Centers for Disease Control and Prevention and leads the National Center for Environmental Health's Safe Food section. Welcome, Dr. Brown.
Thank you. Can you hear me?
Yes.
Okay. So first of all, let me take my turn in thanking you guys for being here today and for your interest in NEARS, which stands for the National Environmental Assessment Reporting System. So as Nicole said, I'm with the Safe Food section in the National Center for Environmental Health. And one of the things that we do is support environmental health professionals at the state and local level. We know that they do a lot of things that are really important to public health, and we want to support them in that. And we do a number of things. We help with water safety. We do a number of things, but of course we also do food safety. And one of the things we realized about 15 years ago was that the environmental health component of foodborne illness outbreak investigations can uncover some really important information about the causes of outbreaks, why they happened, how they happened, the root causes of those outbreaks. But we also knew that CDC wasn't collecting much of that data. Of course, we do have a system at CDC that collects data from outbreak investigations on sort of the epidemiological and the laboratory component from state and local investigations, but very limited data from the environmental health component of those investigations. And as I said, we know that environmental health component can really uncover some valuable information about the causes of and prevention of outbreaks, foodborne outbreaks. So we developed NEARS, the National Environmental Assessment Reporting System, which is a system that is designed to collect information from the environmental health component of outbreak investigations. And in the long run, we'll analyze those data to use for sort of national prevention and investigation recommendations. And we'll be talking some about those data in the next webinars. Today, I'm just going to briefly cover why we think it's useful for state and local health departments to participate in NEARS. And of course, the first one's the one that I've already mentioned, that at the national level, if we can collect all these data and analyze these data, we do think it's going to help us understand better how to prevent outbreaks at the retail level. But we also believe it can help you at where you are right now in your program. It can help you identify the root causes of the outbreaks that you investigate. The data that you collect and report into our system can help you evaluate your program and make improvements. We have a system that allows you to look at your data comprehensively. We can pull reports for you. It can help you understand the causes of the outbreaks that you investigate in your site. And that, of course, can help you improve your own program. If you are in the FDA program standards, this can help you meet Retail Food Program Standard 5, which is focused on foodborne illness outbreak investigation standards. And in the long run, we think participating in NEARS, so going out and collecting environmental health data during outbreak investigations, can help you learn what happened with the immediate outbreak and stop it right then and there. And then also use those data to prevent future outbreaks in your own jurisdiction. And then, of course, when you report the data to CDC, we can analyze those data, look at them as a whole, and really make national recommendations based on those data. We do really want this program to be easy for you. We just want you to use your time to kind of understand what NEARS is about and understand what it would take to participate. We can answer questions for you. You can use this time to take trainings that you might not normally have the time or resources for. So again, thank you for taking the time to participate. And then Nicole, I'll just go on to the next slide. Do a little promotion here. One of the things that we'll do in our next webinars is hear from jurisdictions that are using NEARS. So we'll hear about how they use it, what works for them, what their barriers were. But I do want to just take a minute and let you look at these quotes from some of our users who really feel like NEARS is helpful for them. I won't read it to you, but if you want to just take a minute to read these quotes, just a little rah-rah for NEARS.
I love that, being able to see what others who have participated think. So.
And then, Nicole, are we taking questions at the end?
Yeah, towards the end.
Okay. All right, then. Thank you guys again, and I'll turn it back over to Nicole.
Thank you, Dr. Brown. So, in our mission to continuously improve the Explorer program for CDC NEARS, we've utilized past Explorer participant feedback and suggestions to enhance the program. The 2024 Explorer program has essentially 6 activities each of you will be attending and participating in. The number 1 activity was today's Kickoff webinar. And then signing up for CDC's Environmental Assessment Training Series and completing the training is activity number 2. Number 3 and 4 are webinars in which you will receive training led by CDC NEARS experts, Dr. Brown and her team. Activity number 5 is an addition to the program in response to the feedback and suggestions that I mentioned previously. It'll be focused on like a case study and environmental assessment to be conducted in like small work groups with a NEARS expert moderating to provide support and assistance. And lastly, activity number 6 includes completing a participant final report, which includes an evaluation of the program and provides each of you the opportunity to provide your feedback and suggestions, so to assist us in continuing to improve the program. Here we have the program deliverables for each of the activities with their due dates. The deliverable for each of the webinars is simply to complete an online participant evaluation and submit it. For the EATS activity, the deliverables include downloading the certificate of completion once you finish the program and just sending it to me in an email. And in addition to that one, you will also complete a participant evaluation so you can provide feedback. And lastly, we have a final report, which is due on the very last day of the program, which is May 31st. Next slide, please. We've included a detailed scope of work for you. The registration links for each of the webinars are provided here. You'll want to register for each one of those. And then the deliverable evaluation survey link is also provided there for you. Notice for activity number 2, go back one slide, please. Thank you. For activity number 2, we have included the website URL address so that you can register for and take the CDC NEARS Environmental Assessment Training Series. And the evaluation survey link is also provided there for you. The dates and times for each of the webinars are listed, and we also provided suggested time periods in which you could consider conducting your EATS training, as well as when the final report should be done. Due dates for the deliverables are provided in the far right column, but I would like to point out to everyone that program deliverables should not be a big lift to anybody's workload. Most of the deliverables are simply to complete an evaluation survey, to provide us feedback for the webinars and for the EATS activity. So it shouldn't be much of a lift, but if you have any concerns or run into any issues, please reach out and let us know. All right, next slide, please. All right, so Dr. Brown, I will pass it back over to you so that you can share the different resources and tools that will be available to everyone.
All right, give me just a second. Okay. Okay, so as I said, I sit in the Safe Food section in the National Center for Environmental Health, and we support environmental health professionals in a variety of ways. So I'm just going to cover some of the things that are really specific to food, except for this first one here. This is a short video that we produced a couple of years ago. Really to try to explain what environmental health specialists do and why environmental services are so important. And it does have a food example in here, but it is really sort of a larger video on all the things that environmental health professionals do. It's really a great video. And, you know, if nothing else, you might want to show it to your friends and family if they, you know, ask you questions about what you do for a living. Then you'll see some data here. The Surveillance for Foodborne Disease Outbreaks is a report that gives you some sense of the epidemiology and laboratory data that state and local health departments report to CDC. And then there's some data on sort of the burden of foodborne illness. It's always useful to have those numbers in your pocket when you're trying to justify your food safety activities. And then we do a number of data collections at CDC in restaurants, and you can find some plain language summaries of those findings on our website. And then there's some additional information about NEARS and about outbreak investigation. I believe there's another slide, Nicole. Yeah. And then we have some specific training resources specific to outbreak investigation. So one is a one-pager that really talks about what are root causes of outbreaks, what are the 5 main types. And we have a field guide to help in identifying root causes when you're doing outbreak investigations. And then we have like the really in-depth sort of reference manual on that same topic, which may not be one of the first things that you want to look at. It's a little more in-depth than some of these other sort of overview documents. Right, next slide. We've also just last year developed a video, again, a short little video, you might want to call it a quick train, where we talk about what environmental specialists do during outbreak investigation. So trying to identify the contributing factors to the outbreak. Again, it's really sort of a plain language, quick guide to understanding what it is that outbreak investigators do when they're out in the field. It's gotten a lot of really good feedback. And then we have a number of other resources as well. We have a list of sort of the pre-identified contributing factors to outbreaks that were identified about 30 years ago based on outbreak data and have been revised several times since. And then we have a number of sets of data from NEARS. So NEARS has been around for about 10 years. So we've begun analyzing some of those data. And we have listed what we found, the findings and recommendations from those analyses on this website. And you'll hear some of that in the webinars that we'll be doing. And then we have an infographic on what contributing factors are, preventable causes of foodborne illness. So all of this is on our website. You'll be getting this document, so you'll be able to click on these links to find these resources.
Great. Thank you so much, Dr. Brown. So CDC and NEHA are here to support each of you throughout the program. Please reach out with any questions that arise throughout the program, or if you need guidance, whatever you might need. For any contract, activity, deliverable, or invoice inquiries, please reach out to me at NEHA. And for any assistance regarding CDC NEARS, the system, EATS, resources, tools, please contact the NEARS team at CDC by emailing them at nears@cdc.gov. Next slide. All right, so now we'll open up the floor for any questions that anyone has. Please use the Q&A option located at the bottom of your screen to submit your questions, and I'll address them as they come in.
Nicole, we did have one question just about access to the slides and links.
Oh, okay. Sorry. Thank you. So I do plan on sending out the deck to each of you right after the call. All the links are clickable on the document, and I figured it would just be like the perfect resource for all of you guys to have on hand. So yes, I will be sending that to all of you. All right, so Dr. Brown, we have a question from Suzanne about how long does the EATS training take?
That's a great question. So the EATS training, which I don't think I can tell you a little bit more about it. It's an interactive training that's online, and it kind of walks you through some of the basics of outbreak investigation, particularly from an environmental health perspective. It's kind of a comprehensive training. It's not like an intro training. So depending on how fast you do it and how much time you spend on each of the activities, it could take you 6 to 8 hours. You don't have to do it all in one setting, and it saves your progress. So that is kind of one of the primary ways you're hoping that you'll use the funding through this program, is to take that training. It does get really good feedback. It is interactive. It keeps you engaged. It is an online training, but it does use a number of sort of gaming techniques to keep you engaged. And it does give you a pretty good sense of what an environmental assessment during an outbreak investigation looks like. So 6 to 8 hours, which I feel like can be intimidating, but it's not 6 to 8 hours of your typical PowerPoint slide training.
Thank you, Suzanne, for your question. Any other questions? Well, if you don't think of any now, please feel free to reach out, email it when pops up, okay? We'll go ahead and continue here. So for my final announcement, just in case you haven't heard, NEHA's 2024 Annual Educational Conference will be in Pittsburgh, Pennsylvania this year, July 15th through the 18th, and we would love for you to join us. So with that, no questions. We thank all of you for joining us today. This was a quick webinar. I hope that provided you a really good overview of what the program entails. And thanks for taking the time to meet with us today. As a reminder, you will be prompted to complete an evaluation survey for today's kickoff webinar. And you should receive that right after we close out. It's actually your first deliverable. So thank you again, and please do reach out for any support that you need. All right, have a great day, everyone. Thanks. Oh, I see. Layla has a question. How soon can we begin the other trainings? So each training you can start right away. You can go to the link. I'm going to send the PowerPoint to you. Click on the link, go there, register, and you'll be able to start that. All right. Thank you, everyone. Have a good day.